you'll get like a little message. Here we go. Okay, so we're live on YouTube. Well, we're going to start. I'll start the recording to the cloud as well. Okay, so this is Speaking Club. It's Tuesday. We're focusing on incorporating the patient's perspective, otherwise known as IPP. We're going to start off with a quick review of yesterday, and then we'll have an example from one of the students, and then we're going to go and do more practice. We have Amanda here today, a really great a teacher from SET. She's really popular. She's going to be going in the rooms and giving you guys all feedback. If you want to have a session with Amanda, I highly recommend it. If you're worried about your speaking, let me and Paul know, and we can connect you with Amanda if you want to have a one-to-one or a small group session with her. Okay, so guys, here is the study document. Can everyone see this here? Can everyone see three things?
Yes.
Yeah.
And if I say your names, guys, just put your microphones on and just try and help me review. We're then going to have Abdullah doing a quick example of this. So review time. We are studying incorporating the patient's perspective. Now, according to OET, Emal or Hussein, could you tell me how many different categories are there inside IPP? How many?
Two categories.
Inside
B1, right?
Yeah, B2, B3.
Right? So according to OET, incorporating the patient's perspective, there's at least three things that we should be looking to do. I wonder if we remember what they are. Okay, there's a quick review today. Here's B1, here's B2, here's B3. Here you have some examples. But I'm going to ask Paula. Sorry, Paula, could you put your microphone on?
Yes.
Microphones off. So this one, let's start with this one, B2. Do you remember what B2 was?
Eliciting and explore the patient ideas and concern.
Oh, is that B2 or B1?
B1.
B1, yeah. And Paula, I translated that yesterday to make it more simple, but that was actually the language. Excellent. We're saying that means asking open questions and leaving space for the patient to answer. Paula, you're quoting OET though. That's very impressive. Okay, so Paula, do you remember? Well, no, Paul, we've already had Paula. Ismail, maybe you can tell me this one, Ismail, when the patient is like, or not speaking, or face noises. What's that?
Perhaps he want to show us in another way, his or
yeah. His what? His
Expressions.
maybe what he wants to show you.
His feelings.
His anger, yes, feelings.
What he wants to show you, I suppose, but feelings, right? Opinion, his point of view. This would be non-verbal. What does that mean, Ismail? Non-verbal.
Not speaking.
Yeah, it's responding. So this is responding to the signs of the patient that are non-verbal. All right. He's not speaking. He's not saying, "Doctor, I am anxious now." Right. Instead, he's maybe just not talking very much, or maybe his face is very anxious. I'm trying to do one now. Or maybe he's making noises like we said yesterday, sighing, moaning, or groaning. This could be for pain, right? Maybe he's in pain, but he's not telling you directly that. When that happens, Ismail, what should you do when you recognize that?
Yeah, we can say you seem a little bit down, or
respond to it. Yeah.
Is there anything that bothering you? That is bothering you?
That's a really good one. I'm going to put that on there, Ismail. Is there anything that is bothering you? Excellent. Because that could be pain, or that could be emotional. Yeah, that's a really good one. Okay, so we have to respond to these. Okay, this is all about responding. Yeah, to the patient when they do something that's actually nothing to do with language in terms of spoken English. Okay, but we have to respond with phrases like, "You seem a bit down today," not depressed, right? But if we're worried about their emotions, you can say they seem a bit down today, or is there anything that is bothering you? We talked about this yesterday. Okay, so I'm not going to review this again. I'm just going to ask Farhad, or maybe could I have Claudia or Clara What's
Hello?
B3? What is B3? You said earlier that. What's this?
That's sort of establishing a link between what you say and what you have already elicited from the patient. Like, for instance, linking between the patient feelings and your responses.
Excellent. And I like this word linking, right? I think I use connected, but I'll change it to link, right? So link your explanation to B1, to the things they told you earlier on. Fantastic. So if here, for example, Fahad, if I say, I am afraid of needles, right? Then later on, maybe you're telling me about you need to give me an injection, right? So what would you say here?
I would say that earlier you said you're afraid of the needles, but let me assure you that the needles would be sort of like very small, and it is especially built or made for this kind of circumstances, that it is very painless and there is nothing to worry about.
Brilliant. Absolutely brilliant. Okay. So that's a great example here of exactly what we should be doing. One last thing though, guys, do I have to do all of this all the time? Every single dialogue? Should I be doing B1?
No.
No.
Especially this one. If there's nothing, if there's no signs, then you cannot do it, right? If there's nothing you can link, if there's no explanation to link, then you don't have to do it.
Yes.
Probably, I was talking to Emal yesterday, probably this one is very common, isn't it? But even this one, you don't have to do it. But I would say probably like 95% of the time, you're going to try and do this one. Okay. Why? Why is this one not always, but 95% of dialogues? Why do we need to do this one? Think about it. Asking open questions, leaving space.
Because it's open question, and you have to start from open questions.
Yeah, you can't just immediately begin your consultation, for example, by just you're going to talk and they're going to listen to you, right? You have to. It's all about listening.
Yes.
Listen to them. What's that phrase you have in medicine? Patient-centered. Patient-centered. Well, that would be IPP B1. Listening to the patient. Okay, so we studied this yesterday. We looked at examples, and I introduced a cue card, which I thought was very relevant to this and also very difficult. Does anyone remember the condition that the patient had in the cue card from yesterday? What was the condition?
Yeah.
About the kidney problem.
Yeah, come on, shout out if you think you know. It's end stage
Renal failure.
So a very serious cue card. You don't normally see them so serious like this, but this is a very serious one. So what kind of empathy can I use here? Normal empathy or serious empathy?
Serious.
I might have to use serious. Do I need to use serious right at the start, though?
No.
No.
Because do I know the patient or not?
Yes.
Yeah.
No, then. So every day you're not going to say, oh, I can only imagine what this must be like for you, right? You see them every day here. You can't start with serious empathy. But there is a point in this cue card where the patient says something where you probably need some serious empathy. Where is it here, guys? What's the patient going to say that requires?
When the
In the
patient
middle.
Say that
In the
I
middle.
don't want the recitation if my
Third and the last one.
cardiac arrest.
So that's like saying I kind of want to die. It's a little bit like saying that, isn't it? Don't resuscitate me, right? So what's serious empathy? Do you remember the serious empathy phrases, guys? What did we learn last week? I can only
imagine what you
must be going through, right? Or remember, you can use intensifiers. What can we say? I'm really
sorry.
Very well.
I'm so sorry. I'm really sorry. That kind of thing. Okay. So when you're practicing today, you should be using probably serious empathy, at least here. All right. Now there was other difficulties going through, right? Or remember, you can use there's other difficulties with this cue card as well. We know the patient already. So how do you introduce yourself? Abdullah, could you say hello? We were practicing this yesterday, weren't we?
Yeah.
So
I will say,
go on.
Hi, Alan. Nice to see you again. I'll be looking after you today. And how are you feeling at the moment?
Okay, so quite a simple introduction. Here's our introduction. Okay, we know him already. We see him regularly. Just going to use the name. It's okay to say nice to see you again. You're seeing him every day. It's friendly. Okay. Then he asked me how I'm feeling. Now, how will the patient respond here, guys? What's the patient?
He will describe his feeling, like how he's feeling at the moment.
Immediately describe them? What do we think, guys? Immediately describe them?
No. He will be very relaxing.
So here is where, because I'm reluctant, the doctor needs his IPP here, right? Incorporating patient's perspective. He needs to encourage the patient to talk. He needs B1. All right, so let's try it. I'm not going to talk very much. Abdullah's going to try and get me to talk about my fears and my worries. Okay, so Abdullah, from the start, ready? 3, 2, 1, go.
Hi, Alan. Nice to meet you again. I'll be looking after you today. How are you feeling at the moment?
I'm all right. I'm all right.
Please, could you tell me a bit more about your condition?
Yeah.
Well, you know about my condition already, doctor, don't you?
I do, but you seem a bit distressed.
Let's stop. This is why this is so hard. Now, I think Ismail gave us very, very nice language before. Probably you should use Ismail's phrase, Abdullah. Is there anything bothering you? That would be better. Yeah? Let's try it, okay? From the start, guys. He's going to say, is there anything bothering you? Now here, I think that the patient must say something, okay? Let's try again. 3, 2, 1, go.
Avoid depressed.
Hi, Alan. Nice to see you again. I will be looking after you today. How are you feeling at the moment?
I'm all right. I'm all right.
Is there anything bothering you?
I'm just really worried, and I feel like I'm never going to find a donor.
I can imagine what you're going through to. But I'm sure I will assure you that we will find a perfect match and a donor as soon as possible. We're trying our best.
I just feel like that's never going to happen. I've been waiting for so long. It's never going to happen, doctor.
It will happen, but you have to be patient with us. You know, it's not easy to find a suitable donor. It's always difficult.
Right. Well, I was just thinking about setting up a do not resuscitate as well. If I do have a problem, can we discuss that?
I can imagine what you're going to be going through, but you know, what makes you say this, that you don't want to resuscitation when you're having a cardiac attack?
It's just I feel so down, and I feel so pessimistic about everything. It's never going to happen.
But I can assure you, you're in a good hand. We will try our best, whatever we can, to save your life, and do help you with your condition.
Okay, stop there. So that was very interesting. I think that was really good from Abdullah, because he's trying. You can hear him trying to get me to open up. What did we think about that, guys? It's not easy, this cue card. What did you think about it? Did he get you to open up? What was he asking? First off, was he asking open questions? Yes or no? Was there open questions there? I would say yes.
Yeah.
And maybe you could phrase them slightly better, Abdullah, but you're trying to get me to talk. You're not just ignoring me, okay? What about the empathy side, though? do we think the empathy, the serious empathy, was appropriate here or not? What do you guys think?
Yeah. Yes.
Yeah, I think so.
When I said I think I will never find a donor, is that a serious?
Yeah.
Yeah.
Yeah, I think it is quite serious. I think that was right actually there. Was he repetitive though with his phrases?
Yes.
Yes.
I think so.
Yeah. Yeah.
Right.
A little.
So just use that phrase once. I can only imagine what you must be going through. And then the next time, Abdullah, we're going to use intensifiers. What's the intensifiers again?
Really, really sorry. Or
Really,
sorry.
very, very.
Very, very.
That must be very, very difficult for you. I understand this is really, really hard for you. Okay. So that's just a small thing. But I think in general, Abdullah was trying to do the right thing there. Don't you all agree? He's
Yes.
trying to get the guy to speak. It's not easy.
Yeah,
Also-
he's very good.
Also, I forgot what Bianca said yesterday. Bianca, are you here? Because I forgot what you said. You're quite right, actually.
Yeah.
So here, actually, guys, it's not B1 here. It depends on what the patient says, right? If the patient says, I feel not very well, or I feel not good, I don't feel good. In that case, we need B1, don't we, guys? Right?
Yeah.
So we're going to say, tell me why. Tell me more about that. That's B1. Does everyone agree? B1 is asking open questions, encouraging the patient to talk. But if the patient says, in my example, if the patient says, I am fine, plus a non-verbal signal, right, that this is not true, what do we need then?
I can see that you are a little bit down. So
Moving to B2, aren't we? We're moving to this kind of, you seem a bit down today. Is there anything bothering you?
so yeah.
So it might be B1, it might be B2, guys. Sorry, in my example, I was wrong there. And Bianca was saying that yesterday. However, is this clear what we're practicing today? Because I think we all need to practice this again. Is this clear for you guys? Does anyone have any questions or anything like that?
Can I ask a quick question, please?
Please, Amanda, go on.
Thank you. I did this card with Pushka the other day, and I started the conversation as the nurse, and I said, hi, Alan, is it okay if I sit down and have a chat with you?
Yeah. Okay. So there's so many different ways we could put this, but let's put this on the board. So, hi, blank. Is it okay if I sit down? I didn't think of this and have a chat with you.
Yeah.
So why stopping just with this is a very good idea, Amanda. So what's your idea for this?
Because I was picturing myself walking past your bed, for example, and seeing that you looked like that, you know, like you looked unsettled, you looked troubled. So I decided, oh, I think I'll go and have a chat with you.
And then what's the patient going to say, guys? The patient's going to say, okay, right, sure, right? Then, Amanda, what's your first question, Amanda?
And then tell me how you're feeling today, Alan.
Yeah, so how are you feeling today? Yeah, there you go. And I can say, I'm fine.
Yeah.
And
Okay, well,
say, yeah.
you are, yeah, okay, well, you look a little bit down. As you know, I'm here to, you know, you can tell me anything, we can discuss anything.
Yeah.
If there's anything you want to tell me?
Definitely. Okay, so there's definitely different approaches here, and I like this approach. I like the idea of sitting down as well. It's like already you're telling them, hey, I'm going to give you some of my time. Let's talk.
Yeah.
Good
Sounds
relationship
supportive.
Yeah.
Sounds supportive. Yeah.
And
So,
it just happened naturally when I was, well, I was talking to myself actually when I was practicing it, and it just came out of my mouth naturally, like, oh, hi, Alan, is it okay if I sit down and have a chat?
that's great. And Amanda does practice, don't you? You practice the dialogue.
Yes. And sometimes I play the doctor or the nurse, depending on what the guys want. And then sometimes we'll record it if I use Skype, and then they watch it. And
it's like you're modeling it for them. Okay, fantastic. Yeah. I think that's really, really good. And basically today, guys, Amanda's she might come into your room, give you some tips and suggestions. Okay. I'm going to start to put everyone in the rooms now because we've got about 30 minutes left. Now, if you're bored with this cue card, if you would prefer something else, How am I going to do this? Actually, I was going to share my screen, wasn't I? If you're bored, I promise you tomorrow I'll let you guys choose your own cue card. I just think we need one more day on this cue card. Okay, so I'm going to put you guys all in rooms, and I can let doctors. I'll separate nurses and doctors this time, but you're all going to do the same cue card.